Continuation of assessment. We're now going to be assessing the abdominal area. My wife again, and then also my certified nurse assistant, Gracie, who has an itch, will be helping along as we go through this. First off, we want to start with assessment is visualize. Look at the patient's abdomen. Is it distended? Is there any form of abnormalities noted? There's none noted. Also, what we want to turn around is to check the umbilicus area. Make sure it's not protruding out, which would be a sign of a hernia. And there's nothing out of the ordinary. Next, going to ask the individual if he had any issues of nausea and vomiting.
Just looking at you.
Okay, thank you. And when was your last bowel movement? I have to ask.
Today.
Okay. Have you had any issues within the last week of constipation?
No.
Okay, good. Are you on any medications that may constipate you?
No.
All right, excellent. All right, so first what we're going to do is going to first listen to all 4 quadrants of the abdomen. We're going to start at the very bottom, right lower quadrant, work our way up, go across, and go down. And then after that, going to then listen for the vascular sounds. Going to start up, and it's almost going to be as the way the stomach or the abdomen muscles are going to be shaped. So we're going to go 1, 2, 3, 4, 5, and 6. Alright, so first going to do, and also want to make sure to listen before percussion or palpate because it can move everything all around.
Just a recommendation, sir. That was not very nurse-like.
Now going to assess the vascular sounds. Okay. Sound good. So now we're going to do percussion. Percussion is going to be light. Any pain, discomfort?
No.
Okay. So now I'm going to do what's called a hooking technique to be able to tell where your liver ends. Okay, you may feel a little bit of discomfort, but it is going to be coming right up here. Next, I just check your kidney and go right underneath. I want you to take a deep breath. Good. Now what we're going to do is just a little bit additional teaching is for how to assess if a patient is complaining of right lower quadrant pain to rule out or to rule in that they have appendicitis. Bring the patient's leg up. And as I would bring the leg away from the patient, if they have pain that is abnormal, same with flexion inside having pain. Alright, any pain while I do this?
No.
Coming out?
No.
Alright, so you do not have rule out appendicitis. And lastly, we're just going to check sounds. Okay. That is the end of your abdominal assessment.
Bye. Thanks. Gracie and I say goodbye.